with regards to identity, I see myself as an Indian American physician first and child psychiatrist next. I also treat adults. So I guess I would say child and adult psychiatrist. Well, I'm an avid reader. I love to write and sketch. Um, I have two little kids. Um, I'm a daughter, I'm a sister, I'm a wife. All those go into being, who I am. Of course, a friend. I had a sense that I wanted to be a physician from my very young years. I want to say maybe when I was 5. I knew that I wanted to help people, and I felt that I had some great physicians, and I wanted to emulate them. Um, I also had, an extended family member who was a psychiatrist, so that was definitely on my radar, even though I didn't have a good sense of what a psychiatrist was. So my original thought was, because I loved working with young people, to go into pediatrics. I didn't have a concept of what child psychiatry was. So I ultimately ended up choosing psychiatry because I found it interesting, and it was underserved in India where I originally trained. And I was fortunate to, during my training, to get some exposure to child psychiatry. And I was actually thrilled to know that such a field existed. And the possibility of rendering care to young kids in this very underserved field. At that time in India, there was not a child psychiatry fellowship. So the idea really resonated with me, and that actually brought me to the US to pursue further training.
So originally you wanted to work with children, but not with child psychiatry.
I did not have a concept of a child psychiatrist.
Yeah.
There was exactly one person who I knew of growing up that did child psychiatry work with kids. And she was somebody that had trained in both pediatrics and psychiatry. And during my training years, that was how somebody did child psychiatry work, sought training in both fields. There was not a formal training in child psychiatry up until the fellowship is now 10 years old in India. So I have been involved with a child psychiatry organization originally in India. And then, I had actually done some research work and presented it at an annual conference. And I got so much support that it got me thinking that this would be a useful way of connecting. And once I got to the US and repeated residency training, obviously, APA is our go-to, and subsequently ACAP. Once I started my child psychiatry training, and in terms of the level of involvement, I've been, a trainee member of committees over the years. But I really intensified my involvement within ACAP during the pandemic. One, because I found a network of very supportive folks. I call them my ACAP family or village. And it really helped me get through some of the very difficult times of the pandemic, professionally as well as personally, because it was an opportunity to not just get support but also an inspiration. And I found like-minded people that cheered me on, inspired me, yourself included. And Yeah, the legislative conference really is something that's close to my heart. When I participated in my first legislative conference, I really felt that every child psychiatrist has the power to make a difference in a child's life through policy. And that was really unprecedented and eye-opening for me, because before then I had relegated it to, politicians or leaders in the field. The fact that every voice matters was really brought home to me. And of course, presentations during the annual conference and, mentorship. I'm both a mentee as well as a mentor through ACAP. has been very meaningful. It's a great question. And I was actually thinking about what might really showcase uh, uh, the feeling of being a child psychiatrist. And this happened fairly recently. I actually have, a note that was written to me by a child. She's been in treatment. She was in treatment with me for about 5 years now. She came to me school avoidant and really questioning what to do next. I saw her as she was heading out to college, and she came to say goodbye, and she said, "I'm reading out, dear Dr. Shaligram, thank you so much for helping me through this really hard time in my life. I couldn't have gotten to where I am today without you. Thank you for not letting me give up on school and happiness. You helped me look into my future and see someone successful and worthy of life. I will forever remember you as a kind doctor that got me through something that seemed impossible to overcome." And she says, "With love." She initially wrote thank you, erased it, and says, "With love." So this is her card. And I was so touched that she would stop on her way to college by my clinic and, hand this card over. So that's just one life that I've been able to touch. And it's been a remarkable journey. It's really hard to put it succinctly, but I'm going to try. I'm going to say what child psychiatry means to me. And hopefully that will convey, what it might mean to someone else. So for me, my work really brings meaning to my life. And I see how it alters the trajectory of a young person's future and how they see themselves. I see what an impact I can have on families, entire families, and the way they relate to each other and support each other. It's often hard work, but it's a lot of fun. So that's my quick nutshell on what it means to be a child psychologist. I work at Boston Children's Hospital, where I do outpatient psychiatry, and I also work in the Massachusetts Child Psychiatry Access Program. That's a collaborative care program that consults to pediatricians and primary care providers with the idea of empowering primary care to treat common behavioral health conditions. Outside of that, I also am in part-time private practice where I get to see my adults. I do enjoy seeing the whole age range of folks. So kids as well as older adults are dear to my heart. I also enjoy perinatal psychiatry. And of course, being able to do therapy, which I wouldn't normally be able to do in a hospital setting, is dear to me. That's one of the most thought-provoking questions, that I have been reflecting on. And, some quick thoughts that came to mind is that, first up, I see that as a huge asset. I feel like, I was fortunate to have been trained in India. I received a very good medical education. Um, I had the experience of a different system of care, which, helps me innovate and think outside of the box when I am in my current um, uh, health system. I also have been able to, bring a unique lens to the work that I do. So those are all positives. In terms of the challenges, yes, everybody has challenges, and being international has its own unique challenges. One of the initial challenges has been, in terms of cultural values, there's at least an emphasis on humanity, which meant that self promotion and self advocacy did not, you know, naturally come to me. It was something that I had to work on. And I remember the very first child psychiatry fellowship that I interviewed at. One of the interviewers asked, "What are you most proud of? What accomplishment?" And I really was dumbstruck because that was antithetical to how I was raised And it is completely unacceptable to be talking about accomplishments. Other people should be doing that for you. So those were the values. So being able to, handle questions which felt in a way that's authentic to me, but also in keeping with my values was something I learned over time. The second was being seen as capable because, having had not only did I train in India, I also practiced in attending for a little bit. So I had been able to establish some cred and good respect. Um, but being, new to psychiatry in the US, I had to reestablish that. It didn't come automatically. And sometimes when I asked to do certain things, those opportunities did not come easily. People were skeptical of my ability. So I had to work to prove myself, which I'm sure everybody in similar shoes have to do. Um, I'm trying to think if there's anything else so those were the big ones. And I feel like it has made me a stronger person and a better physician and member of society, really, to be able to have had these experiences and,
What
uh,
after your training, are you having any challenges that you had to face and you had to overcome?
I think those same challenges that I outlined during training also persisted after training. And I've been fortunate to be able to land up in a place where, um, you know, uh, I'm accepted for who I am. I'm appreciated for who I am. Was it automatic? No. Did I have to, pivot at times when, there were certain things that I wanted to do but did not automatically come my way? Yes. But pivoting is a strength. It helped me persevere. So the perseverance muscle is something that I've been able to develop over the years. And yeah, I see that as an ongoing journey. There will be challenges along the way for me as an international psychiatrist. This is just the package it comes in. I'm sure others have other challenges as well. So I think I'm very fortunate all along. One is um, so even in India, being able to, as a woman, get into medical school was a big deal. So my family supported me, and when I came over to the U.S., um, there were times when it's a longer training path to have to do residency all over again, and also to train further in child psychiatry. And at that time, I had my first child had some medical issues, which made me question whether I was better off focusing my attention at home. And at that point, my husband and my program director, residency program director, and some peer mentors that I'm really grateful for, urged me to continue and pursue fellowship training. And along the way, my program director during fellowship and more recently, Dr. Warning and Dr. Walter from Boston Children's Hospital have been, really encouraging me to go after my dreams and think big. So I feel like mentorship is really key in shaping my thinking and approach to what I do. I had so many along the way that I feel like I would not be doing justice uh, if I had to list them, but yourself included. I really look up to so many people within ACAP that have, so selflessly and devotedly given their time and energy and invested in people that come after them in training, in following their path. I feel like I'm very privileged and fortunate to have known them. but I have so many mentors along the way. Some of them have just been one-on-one sessions, one-time sessions, and some of them have been people I've read about, as opposed to actually had, direct contact. But their philosophy has really, resonated with me and made me strive for more. Going back to bringing meaning to the family as well as the child. And in a very simplistic way, seeing a child smile. Very often, when somebody comes in to see me the first time, they start of anxiety or depression or what have you. And, simple interventions, whether in the form of medication or therapy. And the next time I see them, I can tell that they are feeling better. So, that I think is something that's been very rewarding for me. There has been several different ways in which that has, that has impacted what I bring to patient care. Um, I think I had highlighted a little bit in the beginning about the cross-cultural differences and how, that was not, I had highlighted more in the context of the professional work environment, my peers and my superiors. But that also applies to patient work. So I would say the positives has been, um, preconceived notions can be a problem in in any kind of interaction or encounter, whether clinical or not. But one of the beautiful things about living in a country like India is um, we have 600 plus recognized national languages, each with its own associated culture. We have many religions that coexist side by side. And me personally, my family, my community are immigrants within India. So migrated from one part of the country to another, which meant that we were foreign to the part that we settled down in. So that really developed my sense of being able to accept differences. So from my end, I was able to translate some of those skills into clinical encounters. But from the other end, it's not always the same because uh, even though America is not a monolith, there can be certain preconceived notions that come in from patients and families. So being able to build a rapport and, earn a patient's respect and affection. For instance, the card that I just shared is from a patient and family that does not share my ethnic background. Uh, so it was especially meaningful to be able to get to a place where, regardless of how I look and what my name sounds like, I'm accepted. In terms of schooling, I had a very transformative experience with a biology teacher. She just made learning fun. You wanted to show up in her class. And unlike American schools and Indian schools, there's a lot of rote memory that is expected. And her class also did fun experiments, encouraged you to think for yourself and try to make sense of what you were seeing in your textbooks. So it really piqued my interest, and I, read more about the topics that were being taught in class outside of school. So, and the availability of resources in the library, I have to say was really crucial because there's a standard curriculum that is taught at school. So if anybody wanted to extend themselves, having those resources pre-internet was a big deal. So that was really helpful. In terms of college in India, the medical system, we step out of high school and go directly to medical college. It's a medical college, but high school really solidified my interest in zoology and, human physiology. And I also dearly love English. And I had felt that, so in medical school, I was kind of torn because so many of the specialties seemed interesting. And I had a hard time figuring out which specialty. But, I felt like there's so much emphasis on language and being able to understand what the patient is saying to you in psychiatry. And that, and the fact that psychiatry was underserved. So I felt like so many of my peers were going into other specialties. So the accepted specialties within India for a woman is either obstetrics and gynecology or pediatrics. So outside of that, there's not a lot of options open for women doctors. So I was really striking out on my own and doing my own thing in terms of going into psychiatry. I wondered if I might, mention the importance of having a village, a community of support, whatever your dream might be, and persevering. Because, one of the things I learned along the way is to turn obstacles into stepping stones. And if you align your energy with your interest, whether or not, a certain goal is reached, if you have a broad sense of direction, over time, you will make movement towards your goal. And that's what counts.